Welcome, Earth Animals, to Ask Our Vet Live from the Ash Creek Annex of the Earth Animal Studios. I am Dr. Kris, your host. It's good to be back. It's been we had a 1 month hiatus, so it certainly is good to be back. I know they did the last show fell on my birthday, so I got the day off. But it is great to be back with an Ask Our Vet episode. Welcome back to all of our loyal viewers. And certainly a warm welcome to anybody that's new to the program. A couple things about this format. This is our Ask Our Vet Live. So it is a interactive forum where I will field questions from the viewers. I ask a few things, just a couple of housekeeping things at the beginning. First of all, just when you ask your question, try to be as specific as possible, because that helps me, answer your question to the best of my ability. So it's always good to give me as many details as you can. Certainly as well, if you like the show, please share it, the merrier. We've had the show has definitely grown over the last couple of years, and we get people from all over the country and from overseas in Canada. And so, please share it with your friends if you like it. Let's see who's checking in so far today. Hello, Dr. Ulrich. How are you? Thank you for watching. Hi, Diana. Aloha. Hi, Jennifer. We'll get to the questions in just a couple of minutes. I hope everyone's doing well. We're getting a little rain here tonight on the East Coast. It's supposed to be a playoff game for the Yankees tonight, but it got postponed till tomorrow. So we have the night off from viewing. So hopefully anybody who's planning on watching that can watch this, right? Although we're going to be off at 7. Good to see you too. Thanks, Eric. Hi, Joan. Kingston, Ontario. What's the weather like in Kingston, Ontario right now? It's been actually today during the day, it was very mild. The weather has been really beautiful here in Connecticut and New England over the past, it's been a really, really nice fall so far. Just weather-wise and just beautifully sunny and good temperature and everything else. So I hope it's nice from here. Hey, Nora, how are you? Thanks for tuning in. We had a few submitted. It's cold and rainy. Well, Joan, join the club. We're going to it's not too cold, but the temperature's dropping, but it is a little rainy here. Perfect night to be inside, right? Hi, Paula. How are you? You're very welcome. You're very welcome. I enjoy doing this. I think, this is, for me, it's great. This has been, as we've built this and as more and more people have joined and really just, we've developed this little community, and just the interaction with myself and you guys, and between you guys in the chat has been it's been great. So hopefully we'll get a lot of interaction tonight. I'm going to start with one of our pre-submitted questions, because I think it does well. First of all, up here in the East Coast in New England, we generally see an uptick we see a lot of ticks really year round now. And certainly the season ratchets up in the spring and then and certainly in the fall. We can have ticks all through the winter, depending on how cold and snowy and heavy it is. But fleas tend to be fairly seasonal, and we have oftentimes as veterinarians here in our offices, we see an increase in the amount of fleas that we see in the fall. Okay, and Larnie S had a question that was submitted. It's, how do I get rid of fleas? I've done a lot, and anybody that's ever had a flea problem on their pets in their house, it knows that it is difficult. Okay, kind of the standard flea talk that I have with my clients is, the fleas that you see on your pets, but whether it be, cats or dogs or both, are really just the tip of the iceberg. What happens is that the fleas obviously breed and have eggs that fall off the pets, go into carpets, and believe it or not, even in between the wood on hardwood floors, and then hatch. So you get a continual hatching every 21 days or so of more fleas. So it can be very challenging. And, a few years ago, when I was younger, and when we were, they always talked about doing this big, you have to go and bomb the house with these chemicals and things like that. And, I went to a talk a few years ago where they dispelled it, and they said, really, really good husbandry in the house during something like that. Now, so it's twofold, right? Because the vast majority of the problem ends up being in the house. You want to obviously treat your pets. You want to get the fleas off your pets, okay? But it's as or more important that you do things like vacuuming every day, all surfaces, everywhere your pets go. Oftentimes, obviously, cats are in more places than dogs. I always recommend washing your bedding at least once a week in hot water to kill anything that might be on that. Vacuuming all the surfaces. Remember, using your attachments on the couch, under the cushions, under the couch, carpets, hardwood floors. Always emptying that and taking it outside every time you vacuum. And in treating your companion animals, okay, and treating your house, it's still about a 2 to 3 month process. And I think one thing people don't realize too is this can happen whether your little furry family members go outside or not. You can get fleas that can come in the house. A lot of fleas will hatch outside because of, those outdoor critters running around, right? The raccoons and the possums. And a lot of times those are they'll be in the bushes around the house, which means when you open the door, they can jump in. So it does not have to be outdoor animals. And once you get it, you have to be hyper vigilant about your cleaning in the house. And that over time works, but it takes a lot of effort, and it takes a daily work to get it done. And you can do it. It happens. It just takes patience, and it takes, again, daily effort. I hope that helps. All right, let's see. All right, Diana. Diana's 13-year-old fur baby has been on pred for about 6 months now due to initial symptoms of lethargy, unstable walking, moving, decrease in appetite, sneezing, and some instances of vomiting. The pred has helped tremendously. Unfortunately, after costly appointments, blood work, echo, abdominal ultrasound, no definitive cause has been determined. A CT scan would be the next, but what do you think may be the cause? Diana, what you're describing is actually affecting multiple body systems, right? And so, sometimes, and even instability when walking doesn't always mean, I think a lot of people assume that if an animal is wobbly, that it has to be something neurologic, something else, but it doesn't. Weakness can do that. And weakness can become from, not absorbing the nutrients in the food they're eating. So you can have something like IBD, inflammatory bowel disease, that can cause, some of the signs that you're saying. Prednisone will help oftentimes with that if they have severe cases. It does not always show up on abdominal ultrasound, okay? The fact that you've done all this workup and haven't seen anything, I think, when they talk about CTs, they're talking about CTing of the skull and the brain. Could this be due to something central nervous system wise? It could. One of the not necessarily downsides of prednisone, but prednisone in and of itself will decrease inflammation everywhere. Okay. So if you had inflammation in the, in the lungs, in the abdomen, or in the brain, it can work on all of those. So it's hard to localize something if they're on prednisone and they get better, but you don't have any definitive area of focus. So when they start to talk CTs, it's usually of the brain, because that's really, that and MRI is the only way you can kind of look inside the skull. It's so that's a hard one to pinpoint because of the multiple body systems affected. So I don't know, obviously CT scans are expensive. So I don't know if you're going to go that route or not. But it seems like that if you're going to do a diagnostic tool, you've looked at all the other body cavities. To me, it would make sense if the signs are continuing. Okay, Laura. Laura asks, what kind of training do you recommend for separation anxiety? Well, and here's another, these questions are becoming, unfortunately, more and more and more prevalent with the advent of the pandemic, the fact that most of our households are routines. Our companion animals thrive on routines. We talk about routine. And when, frankly, most of us do too. But when the pandemic happened, through all of our routines, everything kind of went out the window. People were scrambling. People were all of a sudden home, then they were not home. We were, and I was really worried when that happened that we were going to see an increase, and probably massively, in anxieties. And also with the adoptions, oftentimes some of these guys that we adopt can come with some form of anxiety, certainly separation being one of the most common. And honestly, there is no necessarily one way of training for separation anxiety. Because honestly, there are all different kind of forms and triggers for these guys. And so I always recommend getting a behaviorist, a trainer in, and kind of recognizing and walking through things. Some animals do well if they're crate trained with it. Other animals don't. So it's very kind of they're all individuals, and I think it is specific. But I always recommend getting a behaviorist in the house to look through kind of where because some of these guys don't get stressed or have separation anxiety because they certain times of the week. Sometimes they do. Sometimes they they're good for a period of time, then they're not good. Some are not good the minute you leave the house. So they're all different. But I think getting a trainer or behaviorist in the house to watch, kind of observe and see kind of what. And maybe make some recommendations on how to lower that. And there's all sorts of tricks as far as, I have 2 rescues, and definitely prone to anxiety. They have each other, and they do really well. They do not do well separated from one another. They are very attached and very content to be with one another. I have one of them is noise phobic and definitely has thunderstorm anxiety. So certainly if that happens, whether we're home or not, we get that. But certain things I do with them, we always leave music on for them when we go. They happen to like Ed Sheeran radio, but some kind of you want kind of quiet, melodic, either acoustic music. A lot of animals are good with reggae. They've shown that kind of melodic beat. So sometimes that can help, but definitely training is key. Hey, Susan, how are you? Let's see. Okay, your dog Delilah has become Vetselin intolerant. I have an appointment in 2 weeks to discuss what to do. Obviously, I haven't read up, but do you have any suggestions at this point? She's on 26 2 times a day and weighs 70 pounds. Yeah, I mean, Susan, this is probably something for you and I to take offline, maybe have a phone conversation about it, kind of walk through where these, if they're doing fructosamine levels or what the sugar levels are, just kind of see where they are. Sometimes, you may have to switch insulins potentially. But this is probably something you and I we'll take it offline. Let's have a phone conversation about it. Okay. And then we can spend some more time on it. Tandy asks, what could I get to put on my shepherd's lower lip, each side? Some places on lower lip cracked and very dry. I have done coconut oil and vitamin E, helped a little. So sometimes, and I've seen this in German shepherds, Tandy, one of the things you want to sometimes you can help as well by things like, what's going as far as topically, you're doing some things topically, and certain vitamin E oftentimes that can help a bit on those areas. But it may be, sometimes it's something that you can help with diet. Sometimes it's something you can help with, introduction of omegas, fish oils and things in the food just to help their body. The other thing too is just make sure they don't have anything else underlying. Sometimes these guys have deep lip grooves and they can get saliva that run in them, and that can help worsen this. So you want to make sure that your veterinarian goes over everything, make sure there's not something else causing this. And then you can kind of work on what you want to do as far as diet, supplements, things like that. And I use vitamin E myself with some of my patients on lips or noses or things like that. All right. All right. All right, Joan. Joan asks, our 1-year-old Chihuahua is toilet trained, but urinates in the house at least once a day. Now with the cold, wet, rainy weather, I'm stressing about the winter. She urinates when she's nervous, i.e. grab a leash to take her out, go to pick her up. Is there any medication that could help with her nerves? So, as always, Joan, one of the things that I recommend, if you have a young animal that is having some of these kind of accidents outside of that, one of what you're describing as far as urinating when nervous is what they call excitatory incontinence, right? And some we see it in dogs, and if they can have it whether they're stressed or nervous or just get excited that they might urinate a little. But if you're getting actual accidents in the house outside of those times, you should at least have a urine done just to make sure there's nothing else underlying. Okay. And then you have to work on training with that. All right. As far as, medications that help with nerves, there's a few things, and certainly naturally you can do some things if your little guys are nervous or anxious. Earth Animal has a liquid remedy, calmness, and it's something that is, again, all natural, herbal, and can help nerve wise. CBD is something that I recommend to clients. I've used with my own pets. Remember, you want to get a hemp based always. Because we don't want any THC, so you don't want to use marijuana products with dogs, but a hemp-based CBD product, and that really can help with it. So I always try something naturally first, but I would check a urine just to be sure there's nothing else kind of underlying. All right. Donna, you have a breeding question. Admittedly, Donna, I don't do a lot of breeding or work with a lot of breeders, but I'll give it a shot. I had 4 females this year. Have a pup. Let's see, raised Yorkies and Morkies. I had 4 females this year. Have a puppy dissolved inside the mom. First time experienced this and wondered what causes this. Now, I will tell you, again, I don't feel like I'm a breeding expert, Donna, but I think it's if you're having something repeated through your guys, it is good to probably work them up and make sure there's not one definitive reason for this. But it may be something that you want to look a little deeper into and make sure that there's not something that, is that they're all kind of, that's going through them all, that's causing, some of this. So definitely, I would run this by your veterinarian for sure. Hey, Barbara, how are you? Thanks for watching. All right, Kimberly, I think this is something that everyone who's had cats, and I've had many in our family throughout my life. I think this is something that a lot of people can sympathize with. Um, so Kimberly is a 2-year-old cat refusing to use the litter box. She had a strong 2-week antibiotic injection, convenia, likely, for the dermatitis. Dermatitis is gone, but she's still refusing the litter box, and I've had her since birth. She seems spooked by the box, having to keep her and her mama cat on the patio because of it. She's also eating only healthy urinary tract food. It's been going on for over 2 months. So the key with this, Kimberly, like I was talking about, and I don't know if this has been done, but whenever these guys are litter box trained and then all of a sudden stop using the litter box, okay? When I get these cases, I take a lot of time with the pet parents asking questions, okay? Because sometimes these things sometimes they're easy and it can be a quick fix, and other times it can be really frustrating, and I understand that. First thing, obviously, we need to know is there something underlying physically that's causing this? Now, it's not only ever a urinary tract infection. Cats can get crystals in the urine that can irritate them. They can get stones. They can have other things that cause them to be in discomfort or have urgency that they can go off. The other thing is, I always go through a litany of questions with the pet parents about, has anything else changed in the house? And, this can be behavioral, obviously. And cats can use this where they're inappropriately urinating around the house as a response to something that they're not happy about. Okay. Did the litter change? Did the box location change? Did you change the kind of box? Have you changed, was the diet changed recently? Are we on the healthy urinary tract food because she's had issues in the past? I think you want to go through all that stuff, because this can be very frustrating, and the longer it continues, the harder it can be oftentimes. So you want to make sure that they're worked up blood and urine, okay, that there's nothing else, because it doesn't always have to be a primary urinary tract issue either. They could be not feeling well for something else and be doing this. Have you brought another animal into the house? Have things changed within the house? Moved, all that. So there's a lot, but you have to. This is kind of leave no stone unturned, because it is something that kind of snowballs, and it's something that can be very frustrating, both obviously for the little kitties and for their pet parents. So you want to go through all of that. All right, let's see. Terry, I've used home remedies on my Chihuahua for diarrhea. Is this good? When I talked to my vet, they wanted me to use their medication. Well, Terry, always, again, I always say, if you can do things naturally, remember, I believe in integrative medicine. I'm classically trained. I've been very lucky to be mentored by Dr. Bob over these years. I've worked on many cases, both in the past and obviously since I've been with Earth Animal. And I do believe in integrative medicine. I believe in both. Okay. And I think oftentimes they can work in concert with one another. All right. And it all depends on, there are many, many different causes of diarrhea. So, if the underlying cause calls for a certain medication, then obviously I would tell you to use that. But so I do, again, if you can do it naturally, that's great. But if there's something that calls for a certain medication, then, and your veterinarian is recommending it, then I think, if you trust and you have a good relationship with your veterinarian, then you want to listen to them. Okay. But at the same time, it never hurts. You always want to ask questions. You want to say, this is what I've been doing. Can we use them together? That sort of thing. All right. Janine, can gabapentin be used to treat arthritis in an 11-year-old dog? Short answer, Janine, is yes. Okay. I think gabapentin has become very popular in the veterinary community in the last few years because of a number of reasons. One of which it does work in a variety of different pain. Okay. It is one of the things that has one of the medications that can be used to treat pain that can be given with other medications concurrently, and has less of an impact on the organs than some of the other anti-inflammatories, right? So the answer is yes. I always believe that how you kind of treat and attack arthritis should always be a multi-tiered system. I always like to go with joint supplements first. Okay, that there's a host of them out there. That things that have glucosamine, chondroitin, MSM, hyaluronic acid, eggshell, collagen. They all meant to help slow the progression, help decrease the inflammation. And so I always believe in having them on a joint supplement as well. And some of them, that's enough for a time. Now, at some point, if you have to add in, you can use certain remedies, aches and pains. You can actually, CBD is oftentimes, again, hemp-based only. Remember, only get veterinary CBD. But it actually, from my experience, it's really good with anxieties and with pain, oftentimes, good ones. So that's all stuff that you can use. You're welcome, Diana. All right, let's see. Lisa, what are your thoughts on conservative management with bracing and physio versus surgery with physio for a partial cranial cruciate ligament tear in a 10-year-old sighthound? Her weight is at the ideal, and she was spayed with an ovary sparing, so she's home. Okay. I think, Lisa, I don't see anything wrong with starting like that and seeing, you can always, going conservative at first if you're getting good results. I think it all depends on the results, and it all depends, for those who aren't aware, cranial cruciate ligament tear is an anterior cruciate tear in people, same ligament. It's from a physiologic standpoint, those are that ligament both in people and in dogs. When you see that ligament, it doesn't seem like it seems like it's not as robust as it should be for what it does. And we see a lot of tears in it in animals, especially an active sporting dog, all right, that's running and making cuts, and that it doesn't take much to tear that or partially tear it. The one thing I'm sure you've already been told, Lisa, is that healing capabilities for a partial tear aren't always great. There's not great blood supply to that, those ligaments. So healing oftentimes is difficult. Now, it depends on how torn it is. Oftentimes partials will fully tear at some point, but I think honestly, if you can certainly try conservative management to start, and if you're not getting the results that you want, then consider surgery. Most people in the veterinary industry consider surgery as the gold standard on those, but I don't have a problem, especially that we've identified that it's a partial, of trying conservative management first. Absolutely. Oh, congrats, Laura. That's great. Oh, okay, Joan. So yeah, I would try some of those things that we talked about to lower that kind of stress. It is that kind of excitatory incontinence sometimes will get better as they age a little bit. Not in all. I do see it probably a little more frequent in the little guys. But I think try some of the natural things and see if that helps. The other thing I want to tell you guys, I know someone was on here. Obviously we have a lot of questions. If I miss your question, you could certainly resubmit it. I'm trying to read these in real time as they go, and they kind of scroll up my screen. So I apologize. I don't get to everybody's questions in these because there are, like I said, there's a tremendous amount of them. So I apologize if sometimes I miss them, but you could certainly resubmit them, and maybe I'll catch it on the second time around. I apologize. Again, I do, in this hour, I do my best to answer, as many as I can. Okay. All right. Melissa, how do you discipline a dog that was abused, came from a kill shelter, malnourished, worms, and has no trust in any human? She is 6 months old, spayed, and has diarrhea. We'll be doing a second round of dewormer next week. She is also not house trained, so it's been challenging. I'm fostering her. She deserves a loving home, but it seems to us that that's a long way off. I will not give up on her, but would like some advice. Okay. So this is a common, Melissa, this is a common tale, right? Where we get these guys and we rescue them and bring them into our homes, and they've had God only knows how tough a past they have. Both my rescues both came off the streets from down south, that had heartworm, had litters, and same type of thing when we got there. When they got to us, especially one of our dogs was really fearful. And I will tell you that the key to me when you're doing this, and it takes patience, and it takes repetition, and again, like we said, schedule. You want to do as much positive reinforcement for the good as you can do. And any little step, because, they're fearful of everything. Again, I mean, you could, whenever we, I get cases like this, or even with my dog, I just, it brings a tear. You can't fathom what these guys have been through. And so it oftentimes takes a lot of time to kind of work through that. But what I did with my guys, and what I recommend to my clients and my pet parents, is that it's really about with those guys, because a lot of them are noise sensitive. I think they do better in these cases with positive reinforcement. So when they do go to when you can get them to go to the bathroom outside, you make the biggest deal in the world. You have to get super excited about a pee-pee outside in the grass, right? And just like, I normally am very much a, I do get wary sometimes about treating them I will train them with treats, but oftentimes I don't like to necessarily potty train them with treats, because sometimes then they just keep going to the door because they just want the treats, and it can confuse them sometimes. But in cases like this, you may need to, and it is literally just praising them for every little thing, just constantly, every little thing they do right. Okay. And, certainly if they urinate on the floor, you need to show them and say, no, you don't have to be, you don't have to be, really raise your voice or, repeat it, but and you want to make sure you're very careful and use the same words for praise, and your inflection of your voice, and because that's very important, because these guys, they will associate that with, doing what they're supposed to and doing what they're not supposed to. So I'm always on the positive reinforcement with them. And it's going to take time. Okay. Sometimes again with them, crate training may be your friend in this case. And because then they're not roaming the household to go to the bathroom. And, obviously the more you have them outside, the better a chance you have of them going to the bathroom outside, because they have to go, the more of a chance you have to praise them. And the more they get that, they really want to kind of assimilate into these, but they just don't have the skills, because they just haven't been exposed to that kind of regimen. So, and it's going to help once you get the parasites gone, and the poop becomes regular, the stool becomes regular, and they don't have urgency with that. and the more longer they're in the house, they realize, oh my God, this is my family. And, so it's all that is really important. All right. Hey, Morgan, how are you? Thank you for coming on. Yeah, Kimberly, I know that that inappropriate urination can be really frustrating, and I think, and that's fine. I think you want to do a complete workup and make sure everything's good, and then you can work, and then I don't ever assume something is behavioral until you've ruled out any sort of physical issues. Okay, I think that's important. Linda, how do I get my mini golden doodle to come to me and stop playing games and making me chase her? I mean, there's different ways, right, Linda? I think it's first of all, it's work, right? I'm not sure how old she is. If she's a young puppy or if this has been going on for a little while. I think in a case like that, some animals are food driven. You may use treats to do it. Again, positive reinforcement and praise. I think it's when you're doing training with these guys, it's a lot of work. Even when I counsel people all the time on initial training of puppies and potty training and leash training and all those things. And when I've gotten when we adopted our latest our girls, and when they were young, it never ceases to amaze me how much work it is when you have these guys and you're just initially going through all of this. You're tired, and you're up late and up early, and it takes, but that being hyper vigilant with that at first and establishing a routine with them and really just sitting and working and having a high degree of patience really pays off down the road. You want to do it. It's one of those things where it pays off, tenfold down the road if you put the time in early and just continue and positive reinforcement. It doesn't, you do it 5 times, you do it 10 times, you do it 100 times. At some point they'll get it. Yeah, so Lane, we were talking before about conservative management with the cranial cruciate tears or versus surgery, and we had said that obviously there's nothing wrong with trying conservative management at first, and yes, they have one of the kind of over the last several years there has been the advent of PT centers. We have some places around where I am where they do things like water treadmill to strengthen, and those are good. Yes, and you especially you want to find a good one. You want to have your veterinarian recommend one. But things like water treadmill where they're walking and take some weight off of it, where they see one of the keys is Elaine, is that you want to. What'll happen with disuse, if they're not putting as much weight on that leg, is they get muscle atrophy. Their muscles actually shrink because they're not using that leg as much as their other limbs. So couple things that can happen there. One is you worry about the other knee. Okay, you worry about the contralateral knee because it's carrying more of the load. Okay, and the other thing too is as they can get weaker and weaker on the other limbs. So certainly things like therapy can help keep that muscle mass to a certain degree to help kind of offset that. Good point. Good question. Hey, Geraldine, how are you? Hope things are good. Thanks for tuning in. So, Geraldine, good question, right? I think, and that's another thing. It's if that if that dog is on has been on Prozac for a short amount of time, you're going to draw it out draw it out. You maybe can wean it a little more, quickly than if they've been on it for a very long time, depending. And there's no really by the book time. I wean them slowly over the course of weeks. Okay. Just to be on the safe side. You don't want to kind of pull the rug out from underneath them. And certainly, I like the fact that you're seeing positive results as you wean with that. And, I think a lot of times these guys can, as you know, when we have certain anxieties, certain behavioral issues, I think oftentimes, to me, first thing is training. Okay. Getting a behaviorist in and going through things. If you need the addition of some anti-anxieties, I think you try natural things first. Okay. I usually, and go to something, some of these other drugs as a kind of last resort. But I'm glad that you're seeing positive results as you wean. Like I said, I usually wean over the course of weeks, not days, just to be on the safe side. Yes. Hey, good fish. Thanks for tuning in. All right, let's see. I've got another one here. We've got a few more. I did promise to get to some of these pre-submitted questions, so I do want to answer a couple of these, and then we'll get back to our questions. Okay. Adriana has a question, a pre-submitted question. She has a Labrador and had to take it to the veterinarian because he was complaining of ear pain, earache. They wash both ears, but the poor dog is still crying, especially at night. What can I do? So, Adriana, I would definitely submit to you that there is probably more than just when you clean ears. Obviously, you go in there with a solution with cotton balls, and you always use cotton balls and not Q-tips, by the way. You go in there with cotton balls and you clean them out, and you can get the debris out of them. But if they're painful or they continue to have debris or pain, they almost definitively have ear infections. Okay. And if they have ear infections, they're going to need medicine, topical medicine, 99% of the time, to help get rid of any bacteria and yeast that's causing this in the ears. Okay. And the other thing I think that's important when we talk about ear infections is, always we want to treat them acutely and get them out of discomfort and clear what they have going on. But a lot of these guys, you do see a lot of ear infections in labs, and sometimes that's, sometimes if they're chronic swimmers, but just in general. But if they have chronic ear infections and something that you fix, and then it comes back in a couple months, it comes back, there's an underlying issue, oftentimes a food sensitivity, or something along that nature, and so you want to address that as well. Because if you can balance out, if you can get rid of any sort of inflammatory, some gut sensitivity that they have, and take that allergen out of it, oftentimes you can really better their position with their ears. But a call to your veterinarian about this is a definitive, and you want to get some topical medicine, because absolutely we don't want your little one here to be in pain at all. So that's got to be, first thing you do is give a ring to your veterinarian. Debbie submitted a question earlier. Her question is, will changing my dog's diet help in the fatty tissue growths on my lab? So fatty tissue growths, I assume, Debbie, you're probably talking about what we call lipomas, right? Lipomas are, and they're very common. We see them every day in general practice. They are an overgrowth. They're benign tumors. Okay, they're benign growths, and they are an overgrowth of normal fat cells. Okay. So they are a growth. They're an abnormal growth, but they are of normal, as opposed to, obviously cancerous or Malignant tumors are an overgrowth of abnormal cells. Okay, two different things. So it isn't one of those things where if these guys are overweight and you drop a lot of weight, that those things will disappear. Now they can come up and go down, and I have had some times where they'll shrink a bit, but it's not because it's not just normal growth of normal fat cells. It doesn't usually make a big difference. All right. Hey, good fish, how are you? I hope everything's good. All right, let's see. Let's get back to some of our questions here. Okay. Kate had a question about dogs. Do dogs get candida, and how do you manage that? Kate, dogs have a yeast that we see very commonly called Malassezia, and it can show up in their ears. It can show up as commonly in their skin, and it's usually we all have a certain amount of yeast and bacteria that kind of are on our skin, and they're no different at all times. And so what happens is, especially during allergy season, is that we can, what will happen is these guys can get itchy, they chew or scratch, and this is cats or dogs, and they can break their skin. And when you disturb the skin, we all have very, skin's an amazing organ. It's highly protective. It's not nearly as porous as you think it is. And it really does a really good job protecting us against the outside kind of, bugs that are floating around and sitting on our skin. But when we break our skin, that's when they can enter, right? Same as, it's the reason why if you cut your finger, you want to wash it really well, because you can see you get the redness and things, you get local infection very easily. So Malassezia is the common yeast that we see on the skin of animals, and it's you treat it differently depending on oftentimes you want to address the underlying cause, believe it or not. So if it's a dietary, again, like we talked about before, a dietary sensitivity. I had given a talk to a group a couple months ago on the immune system. Okay, and discussing the role that our immune system and animals' immune system plays in allergies. And one of the things that is huge in us and our companion animals is our gut health. Okay, our gut health is responsible for 75% of our immune system, and these guys too. And so what happens is we call that the gastrointestinal biome, right? And if you have a gastrointestinal biome that's out of whack, either you have an overgrowth of the wrong bacteria or you have an overgrowth of yeast and things, it can throw off all the other body systems. So when these guys are having skin issues or ear issues or yeast overgrowth or bacteria overgrowth, or they're itching and things like that, you obviously want to get them comfortable and treat the secondary cause, but you need to go back always and look at what the underlying issue is. Treat whole body, right? Because an imbalanced GI system, an imbalanced biome, an imbalanced gut, when it is harmonious and you have the right levels of everything, and you don't have inflammation, it has a positive effect on every other body system. Okay, and really, believe it or not, they're starting to find out study-wise, and doing some studies, preliminary stuff, that can even have an effect on anxieties in our companion animals. And certainly, I mean, that particular fact was really eye-opening for me. So it's really important that nutrition, you focus on nutrition with them. And if you had guys, and certainly with over the years, I've had several allergic dogs of my own, and it really, as I delved into this and really did the research and looked, you can do a lot for them in just balancing out their GI tract. All right. So Murray, I don't know a lot about kombucha for dogs. I'll look into it. I don't know a lot about it. So I'll take a peek and see what we'll talk about it on the next show. Tune into the next show, and I'll do a little research into it. I haven't known anybody that's given it, but I will. I'll look again. I'll look into it. All right, Dawn. Our dog Lila keeps getting bacterial infections of the skin. She gets scabby and open sores. She's had Cytopoint injections and cephalexin, but it keeps coming back. I sent out a Nutriscan allergy test recently, but haven't received it back yet. I'm starting to suspect the raw organics food, less than whey. Not sure what else to do. Do you have any suggestions? Okay, Dawn. Certainly doing an allergy test. You get that back. You can look at potential, like we were just talking about. We look at potential food sensitivities and triggers for that. Okay. Now, it's one of the things you may want to do is get a skin culture. Sometimes these guys start to grow bacteria in their skin that can be very resistant to certain antibiotics. And like I said, I think when you have something like this, you're doing exactly the right thing. You want to look at, do we have dietary sensitivities? What can I do from that standpoint? But you also need to treat the condition at hand. Okay. So I think I always recommend in this case, a skin culture. It's not the cheapest thing in the world. Okay. But neither is multiple trips to the veterinarian, right? I get that. So I think it's worth spending the money on that while you're waiting for the allergy test. Once you get the allergy test, having a conversation with your veterinarian about that, and discussing all that and coming up with a game plan for their dietary needs, staying away from the sensitivities, and then having an informed approach to what's going on in the skin. A lot of these guys have different staffs that can be. One of the staffs that we see is Staphylococcus pseudointermedius that's on a lot of these guys, and sometimes that can be resistant. We find all sorts of other opportunistic bacteria. So I think that's worth it, because then you can direct your treatment instead of just continually maybe throwing antibiotics, switching things. Again, that Cytopoint can reduce itching, but doesn't have any real hypoallergenic properties to it. And I think doing the allergy test is a good idea as well. All right, Murray, what do you suggest to lower liver enzymes? I started giving my girl milk thistle, dandelion, greens, and turmeric. All right, yeah, I mean, certainly all good things, Murray. I think one of the keys to this is remember liver enzymes. So whenever we do blood work, and I am a firm believer in annual blood work for these guys, I think it is a critical part of their overall wellness plan, action plan, if you will. I think you could tell a lot from these blood tests, and certainly you look at it looks at these blood tests look at their whole body systems. All right. So when you have elevated liver enzymes, generally what that means is you have inflammation in the liver. But what they don't tell you is what's causing it. Okay, so they're not specific in that regard, and so it usually takes other diagnostics to check in to find that out. Specifically, oftentimes, X-rays and an ultrasound, if you can do that. Sometimes there are other things that can cause elevation in liver enzymes that's not specifically liver specific. Things like Cushing's disease, which is when the adrenal glands spit out too much of your own cortisol, which can cause this kind of rise in some of the liver enzymes, specifically ALP, which is one of them. But it is so nothing wrong with giving some natural things. There's another product out there. SAMI is something else that they give. There's a product out there that's a combination of SAMI and milk thistle that is used frequently in the veterinary community by a lot of people to help with that. And if it's kind of a non-specific mild inflammation, oftentimes that can help. But Maria, one of the things you want to make sure there's nothing else underlying that's causing that you have to do something else for. All right. Nancy, just quickly, yeah, there's different types of allergy tests that you can do. There's basically three types. Okay, there is the kind of what a lot of the dermatologists do, which is and the endocrinologists will do the skin testing like people get, where they'll actually, they shave a patch on the side of the animal and they do, little flecks with allergens and see what reacts. That is what they consider to be the most accurate and sensitive. It also is the most invasive. Okay. The one that I use typically is the second kind, which is the serum allergy test. You can draw blood, you send it out and they test that for all sorts of, they'll do regional panels for the regional allergens and foods. Okay. So that can kind of give you a guide. There's also saliva tests that can be done to do that. Obviously serum, and I do probably prefer the serum in my practice. They all have some merit, obviously, but it can give you a guide kind of to how then you go about, with your food and identifying sensitivities, and then, can kind of show you kind of seasonally where these guys are going to be at. So I think that's good. You're welcome, Dawn. Oh, okay, Mariah. So yeah, so she has some gallbladder sludging, right? There is, if you find that some of the natural things are not, there you can do some integrative stuff with that. There is a medicine if you're finding that your regimen and what you're doing is not, they're still going up. Then I would. Then there is a product. There's a drug called ursodiol that does oftentimes works very well on that and helps kind of get that moving so it's not backing up. All right. All right, guys. I was supposed to tease this at the beginning of the episode and I forgot. But for those of you that are hanging with us, it's your bonus. We're going to do a quiz question. And whoever gets it right is going to get a bundle of no hides. Okay. So we only got a couple minutes left. So I do want to get to this because I want to get someone a prize today. So here is the quiz question. For those of you that are watching, that watched our Instagram video on the canine Heimlich maneuver that we just put out this previous weekend, my quiz question today is, what was the name of my co-star in the video? Who, by the way, was an exceptional actor, exceptional canine actor, I would say. Quite talented in his debut. Certainly stole the show from me. I can tell you that. It was amazing. So the first person to answer that will win a bundle of no hides. And since I didn't tease it at the beginning and you didn't have time maybe to check it out, we'll give the first person, but I may have to start giving you some hints. All right. We'll give it a minute or two. We'll give it a minute. Let's see. And if you have not seen that video on Instagram, it's good to go and watch. It's been shared a lot. Jennifer, Charlie, yes, thank you. Oh, Jen, by the way, yeah, I know I waved to you when you drive by and beat. But anyway, Jennifer got it. Charlie, yeah, Charlie was. If you haven't seen that video, please go and look at it. I mean, it's informative. The premise of it is, we don't, choking is rare in these guys, but it can happen. And part of what I was getting across in this video is if signs of choking, if they are, because let's face it, a lot of these guys can, anything that they chew on, they can grab a piece of and choke on, so we want to be sure it. The other take home of the video is always watch them when they are chewing on any sort of chew. They should always be observed doing this. I think sometimes people use it for them as pacifiers and give it to them and leave. It is not, again, it's not something that's recommended. You always want to watch them. And I think prevention is key, picking up, making sure there's not things on the floor that they can go and eat and, and choke on. So if you haven't seen that video, it's a good watch. All right. Well, I'm sorry for the people I didn't get to their questions. I think, the hour's gone by this quickly. I certainly come back next time, and I will, I try to get to as many as I can. Thank you, everybody, for joining us this week or this month. It was, as always, great conversation, wonderful questions. If you like what you saw, please like it, share it with your friends and family. More the merrier, like I said. Thank you, everybody, for watching. Have a wonderful weekend, and go Yankees.